to my YouTube channel. My name is Joanna and I am an interpreter. Before I start, really thank you for liking, sharing, subscribing. We are 323. Thank you so much of each of you for being here, for watching, liking or disliking my videos. Please like, share, subscribe, write a comment, and you can suggest any kind of a video related to languages, medical interpreting, business interpreting. I am planning to create a folder talking about the business interpreting in Europe. That was my first experience as an interpreter. But before I do that, I like to finish my videos related to medical interpreter and medical interpreter terminology. And we are talking about gastroenterology. And again, I'm sharing my beautiful painting with you because Mahmoula really liked it. This is my graphic. So we are going to talk about gastroenterological problems. Last week, I did create a video for you guys related to appendix, appendectomy, diarrhea, and constipation, and procedure related to this kind of problems. You can check on the description box above and find those videos. Okay, we are starting with this next video related to medical terminology for interpreters. I'm repeating, I am not a doctor, I am just an interpreter. And if you are an interpreter and if you like to repass medical terminology, you can let this video play while you're cleaning, cooking, running errands, folding clothes, or driving. Whatever you're doing, you can let this video play and allow your brain to absorb a little bit of information time at a time about medical terminology. The reason why I suggest you to do that is because I know, guys, whoever of you work as a medical interpreter, if you are busy as I am, it's going to be very difficult and stressful for you to find time to study medical terminology separately. But if you just listen slowly, these kind of videos that I share, with time, you're going to be able to have a general knowledge, general culture, and your medical encounter are going to be really easy for you. Okay, let's start. We are ready and we are going to talk about hemorrhoids. What is hemorrhoids? What is the reason for it? Procedures, and then eventual solutions. I'm gonna give also some symptoms, the most common thing that you are going to interpret, because during the procedure of a surgery or something like that, or colonoscopy, you're not going to be interpreting, but you are going to explain it before the surgery or after the surgery. You have to interpret having in mind those terminology. Okay, let's start what hemorrhoids are. Hemorrhoids are swollen, inflamed veins that are in the rectum anus. They can create discomfort, bleeding, and pain. There are two types of hemorrhoids, internal and external. The internal ones, they're inside the rectum. They're we don't feel them. If the person suffers, they don't feel them, and they don't and they sometimes just bleed. So this is my painting again. Let's imagine that this is our colon and this is the skin on the side, and this is our anal area. You see here where I'm showing you right now on this side, this is how a normal vein should be. And this is the internal hemorrhoids, which is a bulb of a vein that is going in the rectal area. And when the stool passes, sometimes it can be bulged, broken, and so on. And this is why there is bleeding. And if you look here, I created a small painting that's as in external hemorrhoids, which are on the side of the anus or on the outside. This is some kind of a bulge that are normally more painful and more disturbing for whoever is suffering. Okay, the symptoms of hemorrhoids. The symptoms are itching, irritation in the anal area. This can be related with pain, discomfort, swelling around the rectum, and bleeding. The internal one, I already say, most of the times we don't feel it. They're painless, but they can bleed during bowel movement if we push or have some kind of irritation, or if we suffer constipation. There is these hemorrhoids that are called thrombosed. The thrombosed hemorrhoids are related to external hemorrhoids. This is happen when there is bleeding, and the bleeding creates thrombosis or clots. These could be related with severe pain, swelling, inflammation, and a hard lump on the outside areas. The reason of the hemorrhoids could be different in few. I'm apologizing. We are back again talking about the causes or the reasons for hemorrhoids. And I'm gonna repeat this part again. So it's pushing during the bowel movement, sitting long time in the toilet, chronic diarrhea or constipation. It could be pregnancy, obesity, anal intercourse, a low fiber diet, or heavy lifting. These things could lead to hemorrhoids, and hemorrhoids can lead to bleeding. The exams related to hemorrhoids are 1, 2, 3. Okay, we start with the physical exam, where the doctor examines the anal area and check for lumps, swelling, or irritation. Number 2 is called digital rectal exam, where the doctor uses a hand to check and see the inside the rectal muscle wall. The third is called anoscopy. In this kind of exam, the doctor uses a tube that put in the rectum to see. Sigmoidoscopy is a test that I talk about it in my last video. You can check on the description box above here. And sigmoidoscopy is using a flexible tube to see inside the rectum, one part of the rectum, and also during this exam it could be taken biopsy. We know what biopsy is already, right? Then the colonoscopy is something that you're gonna do so often, so you better know what colonoscopy is. When we do use a long flexible tube that have a light and a camera on its end to examine the colon and the rectum, and if necessary we can take biopsy. There is the surgery is through scope, that they can do a small cut and cut the hemorrhoids out if that's necessary. Most of the times it's cured with other measures, diet and healthy lifestyle. Basically, that was everything for today, talking about hemorrhoids. I know, guys, these kind of videos are a little bit boring for you, but if you listen to them while you're doing your home errands, you're gonna find out that in the end of the day your interpreting session will be really, really easy. Thank you for being here. Thank you for liking, sharing, subscribing. Please like, share, subscribe, write a comment below, request a video. Somebody asked me to do subtitles, and I'm trying to do right now, so stay tuned. I'm working on it, and wait for my new videos every Wednesday and Sunday. I'm trying to be consistent with that. Sometimes I can skip, but I'm gonna be here. Thank you, and have a wonderful day, and stay safe and enjoy the sun. Bye bye.